So good morning and welcome to the latest edition of A Chat with Caroline. Just a reminder to use the chat facility on your screens to ask any questions you may have about this topic of digital, and also a recording of this will be made available, so continue to leave your questions on the chat if you're watching this back as a recording. I'm now going to hand over to Caroline. Thank you, Caroline.
Hi everybody, good to see you all again. And today we've got a whole theme around digital on our plans for continuing to invest in this really important area. First of all, as always, I'm just going to start with a bit of an update on what's going on, a bit of a state of the nation of the last couple of weeks. CQC folks, so as you will remember, CQC came to visit us in the spring last year, and they're now back on site in our adult mental health inpatient areas. Before Christmas they came back and looked at our places of safety and fed back that we had improved significantly, so that was really good news and a massive well done to everybody. This week they're back looking at all of our adult mental health inpatient areas. Then we've been with us already for a couple of days and the feedback we're getting is overwhelmingly positive. So again, do not underestimate the amount of work that has gone into that, and really well done to everybody. They're seeing some real improvements, certainly from a staff perspective, but most importantly when they're talking to service users and carers. Some themes that they know we're still working on are smoking, and I know that we've been putting a real emphasis on this in the last few months, but everything that you can all do to continue to support a smoke-free environment is really, really important. And also our whole approach to vacancies. Now, I'm really pleased that last week at the Trust Board, we approved a whole annual review that's been done by our new Director of Nursing, Maria, a whole new skill mix for our wards through the Safer Staffing review. What that's going to see is more senior nurse posts on our wards, be it Band 6, be it advanced nurse practitioners, be it nurse consultants. It's going to see activity workers integrated into the ward teams. It's going to see more therapies to think about for the future, and also more peer support workers. So a radical increase in peer support workers across all of our wards. That's really important because it means we can start to have people from our wider communities joining our workforce. So well done to everybody is the really key message. From a mental health improvement point of view, that is continuing to do well. We've seen again a reduction overall since last year in our people waiting long times in our places of safety and in our A&Es. We've got at the moment quite high demand, one of the highest we've had for a while. So the teams are doing really well, and certainly in A&Es, more or less everybody is being seen within 4 hours. So really well done to people. And we're really focusing on at the moment in our really thinking through and planning for rehabilitation pathways. So you'll be aware that we're in the process of building new beds, adult rehabilitation beds, but we're also thinking about community pathways, and we're looking at various different partners, East London, Cumbria, Northumberland, Tyne and Wear, and we're doing modelling work jointly with commissioners at the moment, and also working with our private sector partners. So again, some really good work that I think is going to release some more beds for patients, meaning that they don't have to go out of area. So thank you again very much. From a learning disability perspective, this has been a real priority for us in recent months. You'll be aware that we only provide adult and young people's community LD services. We don't provide an intensive support team, and we don't provide any NHS provided beds for people with a learning disability. What this means is that lots of people have to go out of Lancashire and South Cumbria. So again, we've been doing lots of work supported nationally, very helpfully, and we are just coming to a conclusion of that work with really great news that commissioners are now indicating new investment into pathways for people with a learning disability. So I'll continue to keep you updated around that. And again, thank you to everybody that's been involved in that. Going forward, we are thinking very carefully around our staff survey results. You'll be aware that the whole approach to staff engagement has been a real priority in recent months. And whilst our staff survey did see some small signs of improvement across the board really, there's still a long way for us to go. So at the moment, all of the networks are thinking through how we're going to continue to improve engagement for our staff. And then we've also identified some key priorities as a trust that we want to really focus on. And those are including our whole approach to diversity and inclusion, really supporting staff in health and well-being. I'm really keen that we start to think much more radically around flexible working, and also our approach to how we value staff more generally. So we've also set up a new people and culture committee of the board for the first time. So that is going to enable us to really think through how and plan at a board level involving the networks, how we really do focus on our people, but also really importantly our culture. And linked to that, we've got our Listening into Action Pass It On event on March the 23rd. For people that haven't booked onto the event, it's not too late. Please do book on. It's going to be a great event that's going to share all the fabulous work that's been done, led by our staff and our clinicians. So get yourself booked on. Coronavirus. There's obviously a significant focus on this for all of us. I don't even think it's day by day. I think it's hour by hour at the moment. Most importantly is that we keep calm and we follow the advice that has definitely now got a very strong national approach. We've got an internal focus with a group that's meeting now every Wednesday morning. And our next chat with Caroline is going to focus on coronavirus. So please come and watch that and join in. And then the final thing for me to say is that our staff awards are a really, really important part of the year. And we've got those on June the 4th. And nominations are out at the moment, and we've seen some significant increase in nominations. So please get nominating. You can nominate if you're a partner, if you're a service user, if you're a member of staff. So please get nominating. Really important that we thank and reward our staff. The deadline for nominations is the 23rd of March. So that's the headlines of my update. I'm delighted today to have the team with us, the digital team. And if maybe we could just introduce ourselves. Can we start with you, Phil?
Yeah, I'm Phil Horner. I'm Head of Business Intelligence with the Trust.
My name's Ayesha Rahim. I'm the Chief Clinical Information Officer, so I'm the Clinical Lead for Technology in the organisation.
Hi, my name's Sharon O'Connor. I'm the Chief Nursing Information Officer.
Morning everyone, I'm Tom Poulter, I'm Deputy Director of Health Informatics.
Okay, great. So, Ayesha, you're the Chief Clinical Information Officer. Tell us what all of this digital business is about and why are we bothering to have a team and why are we bothering to invest in it? What difference does it make?
Digital's a bit of a buzzword, isn't it?
Yeah.
So we know that that's in the parlance at the moment. People are talking about digital transformation quite a lot. But I think we need to do a bit of myth busting as well. So what it isn't is technology for technology's sake. It's not really about just implementing technology because it's shiny and it's new. We really need to get the basics right so that staff can do their job, so people have got more time to care for our patients, so we provide good high quality services.
Yeah.
And in order to do that, we need to make sure that the basics are in place. So people need kit to do their job and people need to be able to connect to the internet in a reliable manner in order to enable that to happen. So we've seen some really great work that's gone on via the Listening into Action project to provide people with the tools that they need to do their job. But it's also about more than the basics. We really want to get out there and show all the different ways that we can help staff to provide a really good service, because that's why we're all in the NHS. We want to provide really good, high quality care for our patients, and digital is a way of enabling that to happen. So we know that the NHS is under great amounts of pressure. We know we've got some real challenges with workforce. We can't just magic nurses and doctors and AHP colleagues out of the ether. So we need to help everyone to work smarter rather than harder, because we know that people are already working hard. So I'm really proud of all the work that's going on at the moment to help staff to provide that care, to work smarter rather than harder. And I think we're going to hear about some really great stuff that's happening at the moment.
Thank you very much indeed. So Tom, I know, well, we've all been working, but you're going to tell us a little bit about the new digital strategy that's starting to emerge. And what's all that about then?
So that's one of the main pieces of work that I'm leading at the moment. And the digital strategy is one of several enabling strategies which are really about supporting the clinical strategy for the Trust and all of the transformation activities and clinical service developments that are taking place at the moment. So we're currently going through a stakeholder engagement process, and we'll be consulting with staff throughout the Trust about what their requirements and expectations are for digital. But we do already have 3 main objectives that have been stated by the group of clinicians working on the new clinical strategy. So just to briefly mention those, firstly, we have the mainstreaming of digital approaches and providing a wide range of tools and resources, not just for our clinical staff, but also for patients. And part of the ICS digital strategy is very much focused on empowering patients to take more control over their own healthcare, co-producing care plans, and managing their own healthcare records. So, for example, we plan to implement a patient portal and to provide a series of apps that patients can use to record information about their condition and so forth. The second objective is about freeing up time for frontline staff to spend with patients, reducing the burden of information recording and some of the inefficiencies that we know exist with the use of systems at the moment. So this is partly about implementing Rio, but also about optimising the configuration of Rio and the workflow, ensuring access to shared care records with partner organisations and so forth. And the third objective is about data and information, and this is something that we're really focusing on as part of the new strategy in terms of ensuring that the appropriate and relevant information that can be used for service improvement is made available in the right format, in the right time, so that it can be put to better use in looking at clinical outcomes. And I think that's an area that Phil is interested to pick up and talk more
So
about.
we'll come back and understand a little bit more about what that means, and we'll ask Sharon in a minute about the whole clinical engagement. But what's all this information about then? And I know that you fairly new in role and have really been looking at how we can align information with clinical standards and help people to improve.
Yeah. It feels like we've got a whole raft of data out there and numbers in the system. And I think what we really need to start doing, and what we are starting to do, is pull that together in a way that really tells a story. And really importantly for me, it tells a story that's recognised by those clinical teams. So I think there's something about making sure the data quality is right. So we need to get it in front of teams so they can check it out, but they need to be able to do that really quickly. Yeah. So then they've got time to quickly think, how do we compare to other teams in the Trust? What can we show to other teams that might be helpful for other teams to learn from? And how can we learn from other teams who seem to be doing things a little bit better than us, or a little bit more efficiently and getting better outcomes? But also then we can start comparing how we do with the outside world. So comparing, you mentioned a couple of trusts earlier who were doing really good stuff, CNTW. How do we compare there? And then how do we plan our way to get to those standards?
And the fact that you've worked in operations for such a long time and you've got a professional background, Phil, must really help in you understanding, from the grassroots what people really want.
Yeah, certainly in my thinking, I think what would I want when I was doing that role?
Yeah.
But really importantly, what it makes me think is we need to go out and ask those teams now, because those teams who are actually doing the do right this minute, what do they want? And so we're starting to have those conversations. There's a way to go, because I think we need to automate a lot of those systems so they're quick. But in the meantime, what we're going to do is really work at getting the data together in a way that tells a story. Might not be as automated as we want, but we'll start to tell the story, check out the data, and then it's really the onus is on me and the people I work with to work with Tom and Ayesha and Sharon to start thinking about how do we use the clinical systems to feed that. So it's a bit of a kind of a long-term plan, I think. So we'll get better and better at it, but it feels like we're heading in the right direction.
And presumably all the new locality working is something that you're really mindful of, how we get those systems embedded for the new world.
That's right, yeah. So we're really thinking about in a locality for the patient is going to be flowing through the teams in that locality, but then we need to be able to think about how do we look across the organisation at different teams of a similar type. So home treatment teams, for example, how can they learn from one another across the whole of the patch? in order to give the patients in the locality the best experience.
Okay, brilliant. Thank you very much. So this absolutely depends, Sharon, I presume, on getting particularly clinicians excited and engaged in this whole agenda.
Absolutely.
So tell us about what you're doing to help with that.
Yeah, absolutely. We know that if we don't have good clinical engagement, that digital transformation projects will fail. So it's so important that we get staff involved. And these are staff that are using systems. So what we've done is we've resourced our clinical informatics team and expanded that team. So we've now got a number of clinicians that can link and liaise with and collaborate with our frontline staff, and that includes all our admin teams, our nurses, our consultants, everybody across the board that we want to get involved in this digital transformation vision that we have as an organisation. And there's a number of teams already that have been engaged as part of our GDE projects, and moving forward there'll be lots more teams that will be asked to engage with us.
And you've done quite a lot of engagement with all the Pennine transformation work in adult mental health, haven't you?
Absolutely, yeah. And then linked in with that, we want to be able to sort of like give that assurance to staff that we are listening to them. They will feed the digital transformation, so we need to understand what it is they need, what will help them do their jobs efficiently, but ultimately what is going to have a big impact on the patient outcomes and patient care in a safe way. So linked in with all of this, we need to ensure that the systems that we are deploying across the organisation, the new systems, are safe to use, and we need to be able to give that assurance. So all of the clinical informatics team have been trained on the national standards around clinical safety in digital transformation projects and how we do that. So we need to give that assurance to our frontline teams that systems are safe to use. But we will engage with those clinicians as well to get their feedback, to make sure that we completely understand their own processes to support that.
Fab. And I guess, Ayesha, from a clinical perspective, what are some of the things that are emerging that we think, wow, we've started to do some really good digital innovations that are making a difference both for clinicians and for service users and carers?
So one of the things that people may have heard about is the Global Digital Exemplar Programme, or GDE for short, and that's a national scheme to turbocharge the digital transformation in organisations that already have a good level of digital maturity, if you like. So we're starting to see some real tangible outcomes as part of that programme, that suite of projects. And the one that I'd like to speak about first is our seclusion digitisation project. So our colleagues in Guild Lodge in the Inpatient Secure Services Unit have become fully digitised. They're on Rio, and previously the seclusion processes for patients that was a paper-based process, and it was really hard to know if patients were getting good care, if policies were being adhered to. What we've discovered is since we've digitised that process, we've been able to track how long people spend in seclusion, and that duration of time spent in seclusion for patients has actually reduced just as a process of digitising it. And so that's clearly much better for patients, because the shorter time they spend in seclusion safely, then that's a much better experience. And also we can tell that the policy is being adhered to, so that the care that people get when they are in seclusion is far safer. So they're getting their nursing checks, they're getting their medical checks much more reliably, so it's safer for patients. And I think that's something we're really proud of. And the reason that has been so good is we've had such good engagement working with the clinical teams in Guild Lodge to work with us on that, and that's exactly the model that we want to replicate elsewhere.
Fantastic, wonderful. Have we got any questions that have come through at all?
Yeah, we have, relevant to this subject actually, thanks Caroline. So Pam would like to know, in West Lancs, she's based by the way, West Lancs CAMS piloted the Dragon digital dictation software. The evaluation shows significantly reduced admin burden on clinicians, reduced errors and increased staff morale. Other teams have heard about this and would very much like to be able to use this themselves. Are there plans for a wider rollout?
So tell us about that, please.
So this is also a really good example of how we're really listening and taking on board feedback that we're getting from frontline clinicians. So rolling out Dragon Medical One, the digital dictation solution, is part of our GDE programme. And we're also really conscious that we need to think about which teams we deploy those technologies to. And we're aware that our acute care pathway mental health is particularly under pressure. So they will be the teams in our liaison teams and our crisis teams, or is it the START teams? The START teams, thank you. They will be getting the digital dictation, and what that means is that staff will spend far less time typing after doing assessments, because you can speak quicker than you can type, and what we hope that will do is reduce the time that people have spent hunched over a laptop or a desktop computer.
And what does it mean for CAMS? Are we rolling it out for CAMS?
So I think there is some monies also for CAMS to get that technology as well, because we recognise that it's been of such value to that team.
Okay.
So we're working really closely with Steve Tingle and Liz Crabtree about what that might look like and how we expand that.
Fabulous. Have we got any other questions at all?
Not at the moment, Caroline,
No.
but as I say, we'll keep the chat open for any that may come in.
Okay, so that then comes to the end of our chat today. Thank you ever so much for listening. Just a reminder, folks, that our next chat is on April the 1st. It's at 3:00 and it's going to be around our business continuity plans and coronavirus, so really important for us. So thanks very much and see you in a couple of weeks.